Indigestion and constipation do not affect your baby's growth. I, Dr. Neeta Chaudhary, will tell you about that. Hi, mommy. Congratulations, you're pregnant. Now the challenges are there. Constipation is another common symptom of pregnancy. It's very, very common but very troublesome because every day you're going through this. Timely management will keep you free from the painful complications of constipation like pain in the anal area, anal fissures, hemorrhoids. In India, pregnancy-induced piles is a very common and a very big problem. The common queries that you have: what diet should be taken to prevent constipation? What lifestyle modifications? If I have constipation, what treatment? And are the OTC drugs safe in pregnancy? Remedies for anal fissure and anal pain. Can surgery be done for these complications? And does indigestion and constipation affect the baby's growth? We'll see the causes. The progesterone hormone is working and it is increasing day by day. This is sustaining your pregnancy, but it is reducing the gastric motility of your intestines, which causes constipation. Because of pregnancy, your physical activity has reduced and your gastric motility is altered because of that, and you land up in constipation. Because of nausea and vomiting, you have reduced appetite, your fluid intake is also less, and that is a direct culprit for constipation. And your pregnant uterus is putting pressure on the colon. The colon and the uterus are very close by, so that is exerting pressure. That is also one reason. The iron tablets that you take during pregnancy is a big culprit for causing constipation. Ask your doctor, they will give you medicines which don't cause this. Stress is another big factor. There is something called gut-brain axis that is working. Your brain is slowing down. Because of that, even your gut is slowing down. Now the management. Lots of fiber-rich diet. Have lots of fruits, raw vegetables, lots of salads. Your water intake must be adequate. Have buttermilk. Add buttermilk with ginger powder, rock salt and cumin powder. This is a very good pre-probiotic. This will keep your stomach absolutely healthy. How much of water should be taken? Don't drink too much or don't make it too less. It should just be adequate. Whenever you're thirsty, drink water. But there is a rough idea: for every 20 kgs of your weight, you can take 1 liter of liquids. That could include water, lemon juice, coconut water, any other fluids that you are interested in. If you have the urge to go to the toilet, please don't hold your urge. At night, you can take 6 to 7 black raisins along with warm milk. Laxatives are also safe in pregnancy provided you take them with your doctor's advice. Yoga, music, meditation, these are all stress busters. You must look up for all these in our iMumz app. And yes, indigestion and constipation is no way harming your baby. I take guarantee for that. You might be uncomfortable, so please take care of your food, of your water and your thoughts. Everything put together, you're going to have a healthy baby. We have all these things and much more in our iMumz app. Please download that app as it is made only for you. Thank you and namaste.